Hey everyone, I wanted to do this video because I had promised a long time ago that I was going to make a what is POTS video, and just since things have been crazy and life has gotten in the way, I haven't been able to make it, but today I am making it. I've had a lot of stuff going on with like going to doctor's appointments and having to travel for that. And then I got my port place, and then I've been doing home infusions, and Taylor started school, and Willow just doesn't allow me to sit down to do anything in peace and quiet. So she's taking a nap, so I'm taking advantage. Um, so I wanted to let everyone know kind of what POTS is, and a lot of people just think that POTS, which stands for Postural Orthostatic Tachycardia syndrome, they think it's just a tachycardia. They don't realize that it affects so many other parts of the body. Excuse me. Um, so basically, POTS is a autonomic disorder, and the autonomic central nervous system is the part of the body that you don't have control over. It's part of the nervous system where you don't use your brain to do something. So, say if I were to drop my phone on the floor, I have to think, okay, I need to bend over and pick that up. I use my brain to tell myself to bend over and pick up. Like, I think about it. I have to think of, to go and bend down and pick up my phone. But with the autonomic nervous system, you do not have any control over it. You don't think about your heart rate. You don't think about your vision. You don't think about how to digest your food. Your autonomic central nervous system just does it. It's part of your body. So when you have POTS, your autonomic central nervous system is affected. So anything from breathing to vision to digestive, blood pressure, how the blood flows within your body, that kind of stuff that you don't think about, that entire thing is affected. And when you think of POTS or when you think of tachycardia, you just think it's just simple tachycardia. But POTS is more of a postural, hence the postural orthostatic tachycardia syndrome. It's more of a postural issue. You still get the same effects, with some of the symptoms lying down and not just standing. But POTS is when you stand up, your heart rate increases more than 30 beats per minute. And when people have POTS, their heart rate can spike into the 120s, 140s, 160s, 180s, and just keep climbing upon standing. And now it is known that your blood pressure doesn't necessarily have to drop to be considered diagnosed with POTS. They go by heart rate. So if your heart rate increases more than 30 beats per minute upon standing or rising, then you are classified as having POTS, depending upon if you have all the other symptoms that go along with it. The blood pressure in people, some people have hypertension, which is high blood pressure, and some people have hypotension, which is low blood pressure. And I've had the low blood pressure where it's gone down like 80 over 60s, 70s over 60s, 50s. It just is constantly all over the place. And then my heart rate, even sitting is 111, 112, 116, and then standing it shoots up to 140, 160, 170, and then eventually it starts to go back down. When you have an autonomic disorder, it doesn't just affect your heart rate. It makes you extremely tired and very almost lethargic. You are constantly exhausted. The best way to describe the feeling is like having the flu without the sore throat, runny nose, stuffy nose, coughing, all that kind of stuff. It's the overall general feeling of having the flu. So along with the tachycardia, which is the irregular heartbeat, the fast heartbeat, you can also have a slow heart rate. where it drops down into the 40s, and usually only athletes have heart rates in the 40s. So if you're not an athlete and your heart rate is in the 40s, then it's something that really should be checked out, because your heart rate should not be that low unless you are like, running marathons and whatever else. Um, Along with the heart rate and blood pressure, when you stand, your blood flow does not work properly. So when I stand, or when someone with POTS stands, the blood pools into their legs and it turns them purple and black and blue and red, and you'll see white splotches all over. And that is because when standing, the heart does not pump enough blood back up to the brain. And when that happens, all of the blood pools into the legs, and then you become dizzy and you become disoriented and you faint. POTS is also known as like the fainting disease, because a lot of people end up fainting when they stand up, or they stand for long periods of time, because the blood is not circulating properly and the blood pressure drops and the heart rate increases, therefore you pass out. In the very beginning, I used to pass out, but now it's just everything goes completely black, and I have to stand there and kind of like wait a little bit until I can see again. And that's called pre-syncope, where you're about to pass out, but you don't actually pass out. Along with the pooling of blood in the legs, you also have digestive problems. And there are so many different digestive problems that go along with POTS. One of the major ones is gastroparesis, where the stomach is basically paralyzed. There's celiac disease, which is what I have, and that is a allergic reaction. I guess it's an autoimmune disorder, but it's associated with POTS, and the body attacks the small intestine whenever you consume gluten. So I have to eat completely gluten-free. There is a lot of other associated, like IBS, IBD, GERD, gastritis, just a lot of different stomach issues that people with POTS have. And POTS in itself can cause nausea and vomiting and difficulty eating. And when that happens, it makes it really hard to take in fluids. And a person that has POTS is supposed to take in 2 to 3 liters of water a day. But when you have the stomach issues that can be associated with POTS, it makes it practically impossible. Another thing that people with POTS have an issue with is retaining body fluids, or not body fluids, but like fluids within the body, like water or anything like that. So they're told to drink Gatorade. I can't drink Gatorade, but you're supposed to drink water, a lot of fluids, and Gatorade, and increase your sodium. And usually doctors do not tell people to increase their sodium, but someone with POTS has to increase the sodium because it helps hold all of the water and fluids in the body, and it helps the body absorb them. With our bodies, the body doesn't hold it, and it creates a low blood volume, which causes hypovolemia. It causes you to be lightheaded, dizzy, tired, just the overall flu feeling. So one of the treatments for that is IV saline. A lot of doctors don't know about it. A lot of doctors are against it because they are not informed well enough about it. But it does work. It may not work for everybody, but for those who are interested in trying it, I encourage you to try. If you go into the hospital and you notice that after you have a liter or 2 of saline and you feel better, more energized, then you know that it's kind of working for you. But that's a whole different topic, and I'll make another video on that later about POTS and saline therapy. Um, Another thing is going to the bathroom. Like it affects your like urine output. It can affect the bladder. So when you go to the bathroom, it might burn, it might hurt, it might be painful. You either have to go too much or you have difficulty going. So when you go to sit down and go pee, little bits will come out of time or a lot will come out, and then you'll have to sit there because you still feel like you have to go. Um, Another part of it is breathing. You're short of breath a lot. For me, it has been second to my stomach. One of the biggest issues that I have is difficulty breathing. I never feel like I have enough oxygen, and I've thought about talking to my doctor about it, but I don't want to have to rely on anything else right now. Just because there's a lot of medications and there's a lot of dieting, and then I finally got the port, so I'm just kind of trying to ease my way into everything. But a lot of people who are in the process of getting a diagnosis, it takes about 6 to 7 years for someone to actually figure out that it's POTS. A lot of doctors diagnose you with anxiety because of the heart rate. They diagnose you with just IBS because of the stomach. And it's such a misdiagnosed thing that it's terrible that there's not enough awareness out there, because it affects you so much. It's a constant struggle every single day to wake up and be in so much pain, not being able to breathe, not being able to eat, and feeling super sick while eating, constantly so tired. Like I could sit down and just fall asleep sitting up. And a lot of people who don't have POTS, who go to work and stuff, and they're just like, oh, I'm so tired because I work all the time. And people who have POTS, they just look at each other and they're like, our tired is so much different than the normal everyday tired. It isn't the usual, oh, I'm tired because I've had a long day or I'm not getting enough sleep. It's tired because your body just sucks. it's it's terrible. Another associated thing is fibromyalgia, which is bone pain, joint pain, ligament pain. There's also vision problems, which I definitely need to get these updated, that's for sure. Causes blurry vision, cataract, separating of the pupils, and I want to say the cornea or the retina. I can't remember which one it is. But there's that issue as well. There is just a lot of associated things with POTS, and it's very complex. Not a whole lot of doctors know about it. You have to travel outside of your area usually, to find a doctor. The doctors I see are in Miami and Pensacola, because here where I live, nobody knows about it. I see Dr. John Delusky in Miami. I see a gastro, which I don't remember her name, at the University of Miami Hospital, and I see Dr. Thompson, Charles Thompson, in Pensacola, and he actually has POTS himself, which is pretty cool. And definitely on a better path, but like I said, it takes a really long time to get diagnosed. It's a constant day-to-day battle. One moment you could be feeling completely fine, the next second you could feel like you're on your deathbed. A lot of the times it can cause like facial flushing, but that's also associated with mast cell activation syndrome, which I have. And I'll make a separate video on mast cell and um, celiac disease in another video. I'll make them separately. That way it all doesn't kind of like run in together and then you get confused if you already aren't confused, because it's kind of confusing. But basically what starts POTS usually is a virus or an underlying cause. There is an underlying reason why you have POTS. It's not just because some people, their body reacts to having the flu, their body reacts to some kind of virus, or Ehlers-Danlos syndrome, which is a a collagen disorder. The collagen in the body is what is the glue to the body. And when you don't have much of it or very little of it, it causes issues. So that can be an underlying issue, and that's a genetic disorder. There's also like Parkinson's disease, multiple sclerosis, all those things can be underlying causes of POTS. And usually POTS is basically the body's reaction to something. And not everybody who obviously gets the flu and stuff will have POTS. It's just something in someone's body got pissed off, and there you have it. I think the biggest issue with POTS is that when you are finally diagnosed, you're usually diagnosed by a tilt table test, which you lie flat on a table, and then they monitor your heart rate and your blood pressure, and then they lift you up at an angle, and they make you basically sit there. It's any POTS, if you have POTS, it's basically torture. They lift you up at an angle, and they make you stay there, and they try to get you as close to passing out as possible. And then if your heart goes above 30 beats per minute, then you're usually diagnosed with POTS. With that, it does take a long time to get a diagnosis, but if you get to the right doctors, or you do a lot of research, your chances of getting diagnosed quicker are higher. There are medications to help. There is no cure. It's not going to be like, oh, okay, I'm going to take this medication, it goes away. There is no cure. You basically deal with it for the rest of your life, and it sucks, but there are medications to help with the symptoms of POTS, and there are medications to help with the other conditions that you can get associated with POTS. Everyone's body is different, so how you respond to treatment in your body may not be how someone else responds to treatment. So I'll make another video as well explaining what I do for POTS, who I see, what I take, things that have helped me, and also I'll do in that same video like what I take for mast cell and what I do for celiacs and stuff. So yeah, POTS it's different. I don't even know any other way to explain it other than it robs people of so much. And I don't want to say that when you have POTS you should just totally give up, throw in the towel, just sit on your couch and take medicine. But it is so life-changing because you can't just get up and go outside. A part of having POTS, you have a high heat intolerance. It's not just a regular heat intolerance where you go outside and you're like, oh, I feel like I'm going to pass out. Like, you literally, if you go outside and you sit in the heat for even 5 minutes, you could be down for 2 or 3 days. It just wears the body out. We take 3 to 4 times the amount of energy just to stand up. So going outside, going for a walk, going to the grocery store, that stuff burns 3 to 4 times as much energy as a normal person or someone without POTS. Our bodies are just constantly in hyperdrive. Standing up is like running a marathon for us. So when you say I'm tired, or you hear someone say I'm tired, I don't feel good, I have a headache, because that's another thing is bad headaches. It's not just someone saying, I don't feel good. The body literally, it just doesn't have anything left to give. And one of the biggest issues is the fact that it's an invisible illness. It is a chronic illness. You constantly do not feel good. You'll have your good days where you feel okay, and then you'll have your bad days where you can hardly move. And so many people don't think that it's a real thing. They think it's all in your head. And because you look fine on the outside, oh, you must be okay on the inside. But that's the farthest thing from the truth. And people who have this disorder are amazing because they learn to go about their day-to-day life the best that they can, and learn to look okay on the outside and smile and be able to push through it, and feel so crappy on the inside, but sometimes you would never even know. It's crazy. You learn to have a whole new respect for people who have chronic illnesses, and I've definitely have met some amazing people. POTS is extremely debilitating. A lot of people who have POTS end up having to quit working. Their social life, their family, their relationships are affected, and my best advice is to join a support group, because that is where you're going to not feel so alone and secluded, and just inform people of the disease. A lot of people cannot hold down jobs because of the unstableness. Not everybody is the same. Not everyone will have the same symptoms. Not everyone will have the same severity. But a lot of people end up having to stop working, and a lot of people eventually get approved for disability. It does take a while because, again, it's not a very common thing that people hear about. So, and because it's not so known by disability or by doctors and stuff like that, it does take longer and a lot harder. But I got an attorney, so I'm hoping that this time that'll help. With POTS, it is said to be, the disability of it is said to be compared to someone with chronic heart disease and heart failure, diabetes. It is something that you would never guess could be that disabling. It doesn't look like it. It doesn't seem like it. But I guess until you actually have it, you don't really understand. But I want people to be informed about it. I want people to know about it. I want people to research and support other people, because it is very hard to deal with. It is very hard to get people to understand. People don't understand a lot of times what they can't see, and you can't see the war that goes on inside the body. So, yeah. Alright, well, thanks for watching. If you like this video, give it a thumbs up. Subscribe down below if you want to see more videos and see what I do to help with POTS. And I'm hoping to vlog more soon. I just kind of wanted to get a bunch of videos up before I started vlogging again. I know it's been a while, but I'm really going to try to stay on top of it the best that I can. And yeah, bye!